Hello and good evening, everyone. Welcome to our series on hydrocele. It will be a two-part series, and for the first part, I will be your teacher. My name is Mohammad Hassan. I'm a third-year medical student here at Kathiyar Medical College in Kathiyar. So we have designed this course on the various anatomical topics, and we'll be discussing on the topic of hydrocele. So in this lecture in particular, we will deal with the surgical anatomy, we will deal with the pathophysiology, and we'll deal with the different various types of hydrocele that are actually present. So a lot of you, if you are a senior in a medical college, you might have actually come across this term of hydrocele. You might have been fortunate enough to see these patients of hydrocele if you have been posted in the surgical department. Otherwise, if you're not a medical student and you're just in your first year or a pre-med, you might have come across an image of the scrotal sac just being so full and so thick, and your mind might have wandered in the position of what is inside of this. So what is inside of this? So one way our mind tells us is something is filled inside of it, maybe fluid, and you're actually right. The mind actually finds different ways to actually be comfortable with that. So yes, there is actually collection of fluid in your scrotal sac, which makes the scrotal sac become so huge in consistency and in shape and size. So let's start off by the very definition. So hydrocele is a condition in which there is fluid accumulation between the two layers of the tunica vaginalis of testis. See, I'll repeat it again, and we'll go one by one and understand this entire definition. Hydrocele is a condition in which there is fluid accumulation between the two layers of tunica vaginalis of the testis. So to understand this complete definition, many of you guys might be wondering, what is this word right here, tunica vaginalis? And to explain this tunica vaginalis, I would like to show you this diagram here. So this is not an exactly correct anatomical diagram. So this diagram right here is of the testis showing its various coverings. Okay, please keep in mind that this is not a very accurate anatomical diagram. In an exact anatomical diagram, you will have here a sac-like structure where the physiological maturation of sperms takes place. That is the epididymis, which then continues into the vas deferens, and there are other structures as well. But just to explain the whole anatomy of how of what actually happens in hydrocele, this is a very nice and very simple and easy diagram. You can find it on the internet as well. The thing about this diagram is that it basically shows you the covering of the testes. So if you notice right here, you can see this green color line that comes. Okay, so this line actually is the covering which is coming from the abdominal cavity. And if you have studied anything about anatomy, you will know that the abdominal wall is lined by a covering on the inside, which is known as the peritoneum. Okay, so what you guys see right here is basically the peritoneum, which is running across the entire abdominal cavity. And as it comes down here near the groin region, you can see that it comes like this in a V shape. Okay, so what you see here is this green color line is basically the peritoneum, and this deep ring and this external deep ring, superficial ring, you will actually come across these structures, and you will know more about these structures on our lecture on hernia. So do not forget to miss that out. Okay, so this right here is the peritoneal folds that are actually coming in, and these folds, actually the peritoneum comes in and then it goes out. Okay, so what happens is that when the peritoneum comes in, it is actually very much attached to the counterpart that is going up. But when it comes down into the scrotal sac where the actual testis is, okay, the two layers actually separate from each other, and they create a space in between which is known as tunica vaginalis. As you guys can see here, the peritoneum came in and it is very much attached with its counterpart that is going upwards, and here that both the layers separate, and this space right here that is formed, I'll see right here if I have a pencil to show you guys. Yes, this space right here that you guys are seeing, this entire space, yes, this is tunica vaginalis. Okay, so this is the tunica vaginalis parietal layer, the layer which is on the outside, and then this is tunica vaginalis visceral layer. So visceral means attached to the visceral organ. So yes, this layer is more attached to the testis. So this is known as tunica vaginalis visceral layer, and this is known as tunica vaginalis parietal layer, the layer on the outside. And after that, you have the internal spermatic fascia, you have the cremaster muscle, you have the external spermatic fascia, and then you have the dartus muscle. So all of these muscles actually cover the whole scrotal sac. You will actually learn about these in great details in your anatomy lectures on on the male reproductive organs. But just to give you the whole surgical anatomy of what actually happens in a hernia and to understand the basic anatomy of testis, I have used this diagram right here, which can actually tell you what tunica vaginalis basically is. And it is the fluid accumulation in this part right here that I have colored in black. It is the fluid accumulation in this part that actually forms the hydrocele. So the fluid just gets accumulated, accumulated, and now basically at the end of the day you have fluid filled tunica vaginalis, which makes the scrotal sac big. Okay, so now what basically happens? Okay, so your mind might have this curiosity of asking, why does there is a peritoneal fold in the testis and the scrotum? Why can't we just have a single layer? Why can't we have just basically start up with the internal spermatic fascia? How does this whole peritoneum actually comes inside of the scrotum sac? From the entire abdominal cavity it comes down into your scrotal sac. How does this actually happen? So to understand this concept, I would actually like to begin from the very start of what actually happens of what how the testis actually comes inside the scrotal sac, how the testis actually develops, the entire development of the testis and the scrotal sac. Okay, so we're gonna start with this right now. Yes. So as you can see, how the basic structures of what actually form tunica vaginalis would also help you explain the pathophysiology of what actually happens in the scrotum sac. See, to solve this curiosity in your mind, you will actually have to just go a little bit deep more inside your definition of hydrocele, okay? And you actually have to be a little more specific on what actually happens. So, a little more advanced definition, a little more explanatory that can just clear the haze in your mind. Hydrocele is a condition in which there is accumulation of fluid in the processus vaginalis of the peritoneum takes place. Okay, so these are actually the two new terms. Okay, so we began with tunica vaginalis, which was in the scrotum, and now I'm mentioning guys right here the processus vaginalis of the peritone. Okay, so these might actually confuse you a lot, but once I explain, that would actually be understandable to you. Okay, so at the time of birth, testis is basically not an organ that is actually formed in the scrotum. Testis is basically an abdominal organ. Okay, so any abdominal organ at any point in your life is basically covered by peritone. So and so was same with the testis. Okay, so I have a few diagrams here. If you just take a look here, we'll actually appreciate a lot of what actually basically is happening. So this is the stage 1 of basically what's happening here. Is that the stage 1 where your testis is basically an anatomical abdominal structure, okay, and it is lined by this peritoneum blue color layer that you guys can see, and it is this is the scrotal sac, and this scrotal sac is attached with a muscle known as gubernaculum. Okay, so it is this muscle, the gubernaculum, which actually pulls the testes down from the abdominal to the scrotal sac. Okay, so this gubernaculum right here, it is now actually trying to pull the testis muscle down into the abdominal cavity. So here is the stage 2 here right here. So as you can see, the gubernaculum actually now starts to pull the testes down into the scrotal sac. So as you guys can see that this is the testes. Now it is covered by peritoneal cavity, this entire layer, which is actually intact and really smooth. And as the muscle pulls it down, the testes actually pushes the peritoneum, which actually create folds inside the peritoneum. and it is the formation of these folds that actually forms the beginning of tunica vaginalis. Okay, so you guys can see here, this is the formation of processus vaginalis. This fold right here, which is actually created, this fold right here is basically created by the pulling of testes by the gymnocular muscle, which now actually is now pushing the peritoneal cavity down, which is actually now pushing the peritoneal layers downwards. Okay, now this process continues up until the child is born, and now the entire gymnoculum is now pushing and pulling the entire testes down to the scrotal sac, and with this fold right here, it now keeps on increasing. So this is the stage 3 right here. And what happens in this is that, as you guys can see, the fold has grown too much big with this little connection right here, and you guys can see this is the now the processus vaginalis now in the stage 3 of what actually happened at the last stage. And due to this constantly pushing and pulling of what actually happens is there is the formation of this is the same peritoneal cavity that was actually here. Now after constant pulling by the gymnocular muscle and the constant pulling of the testes, this peritoneal cavity ended up like this, and it is this structure that is formed, the circle, the structure which I am just coloring a little bit in red. This now forms tunica vaginalis. The processus vaginalis that was formed in the during birth now forms tunica vaginalis, and then this forms the closed part of processus vaginalis. So this part basically closes up, so the connection between the peritoneum and the abdomen ends up here, and then this entire layer of the peritoneal cavity, both the layers that comes up and goes down, this one actually forms the tunica vaginalis. So this diagram right here will help you actually appreciate a little more of what basically I showed you guys actually in the figure 1, which was this. The entire peritoneal cavity comes here and then goes up. This actually forms the tunica vaginalis. This entire thing is basically the peritoneum layer. Okay, and it was this testes, it was this testes that was basically up in the abdominal cavity, which then came down by the constant pulling of gymnocular muscle. So this is how tunica vaginalis is formed, and it is the filling and this accumulation of fluid in this tunica vaginalis, which is basically the whole concept behind the hydrocele. And processus vaginalis is basically the precursor of tunica vaginalis. Okay. So you can see in this diagram, so this diagram right here is basically a more correct form of diagram, an anatomically correct diagram right here, as you guys can see, which will actually help you understand hydrocele in a more better anatomical sense. What I have been showing you guys is basically diagrams to build your concepts, but this is a more anatomical based diagram. You can see there is testes here, there's epididymis, where actually the physiological maturation of sperms takes place. This is testicular artery, the papilliform plexus of veins, and this entire yellow color covering that you guys can see, this entire yellow color covering, that is the tunica vaginalis. Now you can see this is the healthy testicle, and what happens in hydrocele is that the entire structures are the same, but there is accumulation of fluid in this yellow color sac, which actually leads to the enlargement of the size of tunica vaginalis. Now, so moving on to our last part of the lecture. So these are the types. So hydrocele is of many types. Okay, and you can find various textbooks on this one, on which part is actually nice, which type of classification is actually more easy to learn, and different textbooks depending on which textbook you really like to follow and the textbook that your professors actually prefer. You can find that hydrocele has very different types of classification, but the classification right here which I'm using is actually a more trusted type of classification, a classification which is accepted by a lot of professors that I have been working with. So this classification basically starts by dividing hydrocele into congenital and acquired. The congenital hydrocele is basically a communicating type of hydrocele. You can also call it hernia, Okay, so in this communicating hydrocele, we'll actually learn about more of this in a little bit. But in this communicating type of hydrocele, you can also have hernia. There is really possibilities of hernia, and the reason why there is a lot of chances of getting a hernia is there is patency of processus vaginalis. So if you guys remember in the diagram that I showed above, this one, you can see the processus vaginalis is closed. You guys can see this part right here, the processus vaginalis becomes closed. So there is basically no connection between the area that is here and the area that is here. Okay, but due to this, wait a second, I'll just change the color. It'll actually make you guys more easy to understand. Yes, so basically due to this closure that you guys can see, I'll just use a highlighter here, that will be more easy for every one of us. Yes, so basically it's the closed part of this processus vaginalis, this part right here that I'm shading, which is actually stops the communication between the abdominal cavity and the scrotal sac. So because of this part is now closed, the processus vaginalis is now called non-patent. But what happens in the cases of communicating hernia or congenital communicating hydrocele or congenital hydrocele is that your processus vaginalis remains intact. So basically, the closed part that was present in a normal testis is not present. The patent, the processus vaginalis is still large. It has not yet closed. So the communication between the abdominal cavity and the scrotal sac does not take place. Okay, there is an open entry space, and as we all know that the contents of abdominal wall can actually slip into the scrotal sac. And what do you call when the contents of abdominal cavity are not there in the abdominal cavity? We call it a hernia. You guys have studied about hernia in your anatomy and surgery classes, but do make sure to check out our video on that. So because of this, this is also known as hernia. The next part is the acquired. Now the acquired type of hydrocele are basically known as non-communicating. So basically this means that your hydrocele is not taking place of the communication within abdominal cavity and the scrotal sac. So the problem basically is from within. Okay, so this is the main concept behind the non-communicating type of one. So these are basically based on the imbalance between the secretion and reabsorption of fluid. So basically there is nothing coming in and out of the scrotal sac, but you're still getting a hydrocele. So somewhere or another there is excess production of fluid, excess secretion of fluid, or there is decreased absorption of fluid. Those two are the only reasons why you are getting a hydrocele when there is no communication of scrotal sac with any other organ of the body. So now these two are divided into two types. They're basically the primary and the secondary type of hydroceles. Primary and secondary non-communicating type of hydroceles. So we will discuss about all of this in a great more detail in a few seconds. But this is here just to give you a brief idea of how hydrocele is classified and how one can actually go on to understanding the different types of hydrocele in a much more easier manner. So now basically we study the communicating and the non-communicating type of hydrocele. So we'll just look into it. So here I would like to take your attention here to this diagram right here. Yes, so this is a normal abdominal cavity. As you can see here, there is testicle. This is the testicle, this is the scrotum, and this is pretty normal. There is no fluid accumulation here, everything is normal. In the communicating type of hydrocele, you can see that there is enlarged testes, but as you can see, this enlargement is actually coming from the abdominal cavity. Just take a look here, the part that I'm circling. The enlargement is coming from the abdominal cavity. There is actually patency of the processus vaginalis, which is actually making the scrotal sac swell up. It is the fluid and the contents coming from the abdominal cavity which is actually making it swell. In a non-communicating one, you guys can see that there is no communication between the abdominal cavity and the scrotal sac, but still there is swelling, hydrocele. And then there is the hydrocele of the cord. We'll actually discuss this in a great more detail in a few seconds. So these two are basically a type of hydrocele that we'll be focusing on, the communicating and the non-communicating. So as you can see here, the communicating hydrocele is a hydrocele that has an opening referred to as the communication. The processus vaginalis that is still patent is referred to here as the communication into the abdominal cavity. The opening allows the abdominal fluid right here, to pass through into the scrotum. So it is basically the abdominal fluid that is coming through the patent processus vaginalis into the scrotal sac, which actually makes the hydrocele. The processus vaginalis, if it remains open, which in this case is, fluid flows back and forth into the abdominal cavity and the scrotum. Okay, so now comes the non-communicating type of hydrocele. So now in non-communicating type of hydrocele basically forms as a result of fluid being trapped in the scrotum after the canal and the sac close. So basically this canal has actually been closed, so there is no communication here. So the only reason that your hydrocele can take place is, again, that I've said beforehand as well, that there is excess secretion or there is decreased absorption. There are the only two reasons you can have an increased hydrocele right here. Since there is no connection, with the abdomen, the fluid is not able to move back and through the canal into the abdomen. A non-communicating type of hydrocele happens when the sac closes like normal, but the boy's body does not absorb the fluid inside it. One of the most common causes of a non-communicating type of hydrocele is not basically the excess production of fluid, but sometimes is not proper absorption of fluid. The canal has closed, but still the body hasn't absorbed the fluid that was inside the canal. Now, so moving on with our next topic is basically, so what is now primary hydrocele? We have looked into what communicating and what non-communicating is, and now in non-communicating we have primary and we have secondary. Okay, so a primary hydrocele mainly occurs due to accumulation of fluid. Okay, so in primary hydrocele basically the fluid has accumulated in your scrotal sac, which has made your scrotal sac huge. Okay, so when there is a case of primary hydrocele, the scrotal sac actually attains moderate to a big size of scrotal sac, and its consistency is tense and cystic. When you actually take hold of the scrotal sac, you can actually find that it is pretty tense. It's actually very hard to just try to press it, and you can actually feel like there is some cyst type of structure that is actually developed there. And in this cases, if the scrotal sac has become too big, the penis might actually get buried in the scrotum, and it is very difficult to palpate the testis right there. You cannot actually try to find out where the testis is. And one of the most important thing that a lot of the doctors actually use to figure out whether this is part of testis, or which is whether this is a part of hydrocele or whether this is a part of hernia, is that doctors try to actually check out the consistency of the structures, and they actually try to palpate the testis. Okay, so if you have a hernia, you can actually push it back up. Okay, or you can actually have a cuff reflex, but that is not present in case of a hydrocele. Okay, and then transrumination is positive. So transrumination is basically a test that we do in patients of hydrocele. You actually take up the scrotal sac, and then you take up a torch and you actually attach it to the skin of the scrotal sac, and then you press it on, and you can actually check that there is a bright reddish orange color that takes place inside the scrotal sac, indicating that there is lots and lots of fluid is filled inside it. So if you have a structure like that, if the entire thing takes up fluid, yellowish orangish color, that means that your translumination test is positive, and it is highly likely to be a case of primary hydrocele. Now, primary hydrocele is divided into many types. We'll actually take a look at it in our last slide. So this is what a primary hydrocele actually is. Now moving on to secondary hydrocele. So secondary hydrocele basically takes place due to excess production of fluid. In this case, in the cases of the primary one, there is accumulation of fluid. And one thing that might actually come to your mind is, how does this entire primary hydrocele take place? I mean, why there is production of fluid, why there is accumulation of fluid? So then the basic answer is doctors still don't know it. So it's basically, I don't know. And in medical terms we actually call it idiopathic. A fancy name of saying I don't know is idiopathic. So the conditions, so the causes of primary hydrocele are basically idiopathic, but for secondary hydrocele you actually have a lot of reasons why a secondary hydrocele might takes place. Okay, and one of the many causes of secondary hydrocele is trauma, infection, a tumor in the testis. Okay, if your testis has been if the scrotal sac has have had any trauma, then it might cause inflammation and infection, which will lead to the swelling of the scrotal sac. Any infection can take place. Tumor of the testes might actually also cause hydrocele. One of the most common causes is this epididymo orchitis. And what happens in this is that the scrotal sac actually takes big, and this is actually a painless swelling. In young males, as they are more sexually active, there are the one of the most important causes of how infection takes place is through this chlamydia trachomatis is known to causes, whereas in older males, as they become less sexually active, E. coli becomes one of the main pathogens to causes, as urinary retention starts to happen in older cases. E. coli is a very common pathogen that is present in urinary retention, which now causes the infection and causes hydrocele. Scrotum usually has a small size. In cases of secondary hydrocele, the scrotum actually does not become too much large in size, and because it is so not that large in size, that your testis is actually very much palpable. And when you actually touch the scrotal sac, its consistency is, it has a lax cystic type of consistency. I don't actually have the right way to show you guys, but you will actually know it, that when you actually touch it, you can actually feel that it's a little bit laxy, a little bit squishy. Whereas in cases of primary hydrocele, it is not like that. When you touch the process, when you actually touch the scrotum of a primary hydrocele, it is very tense, and the more you press it, you may actually feel the type of cystic. And because it is such small in size and it is so much squishy, when you actually do a transillumination test, when you actually attach the torch and press it on, you might not actually get a bright yellow and orangish color because of this, because of the inside structures in a secondary hydrocele. This become light is not able to pass, and your transillumination test will actually be negative. So now, as I was speaking, primary hydrocele has its different types. So before we actually start up with the different types, I would actually like to remind you that primary hydrocele is now basically a non-communicating type of hydrocele. So basically, you will have a closed and a patent processus vaginalis here, whereas in other types there won't be a patent processus vaginalis. So what happens is, in this congenital hydrocele, as we have already discussed, is that you can actually check out this for one number right here, here, here. If you take a look at it, you can see that this processus vaginalis is still patent. It has not yet closed. It is still open. So there is the connection between the abdominal cavity and there is connection between the scrotal sac. So the fluid actually drains from the abdominal cavity into the scrotal sac. So you can have a communicating type. The communicating type is also known as the congenital hydrocele, and fluid actually comes from the abdominal cavity into the scrotal sac. This is a congenital type of hydrocele. In the second one, as you guys can see, there is no covering of tunica vaginalis right here, and the entire process vaginalis comes down and it gets closed just right here. And since it is closed at an abrupt point, in a point where it is actually directly from the abdominal cavity, actually the contents of the abdominal cavity flow from here into just right here, and it stops just at the place of the obstruction of the tunica vaginalis. So it actually forms a droplet type of shape. Here is the testis, and the hydrocele just comes right here, and on USG you will find actually a drop shape right here. So it is known as a funicular hydrocele. Now moving on to the third one, as you can see in the third one is the processus vaginalis has actually closed a lot before than where it should have stopped, and the fluid was not able to actually drain out, actually get absorbed, and because of this there is an accumulation of so much fluid right here, which actually leads to the formation, which actually leads to the accumulation of fluid. So this right here is known as an infantile hydrocele. Now do not confuse this word infantile, that it mostly takes place in infant, that it is not like that. Okay, infantile basically means that here this is the premature closure of this processus vaginalis right here. So there is accumulation of fluid in the part below the part of the closure. Now moving on to the fourth one. So now as you can see in the fourth one, that the processus vaginalis has closed just right up above the testes, same the one that happened in funicular hydrocele. But if you notice above it, above the external ring, you can see that there is constriction. You can see that there is constriction of the processus vaginalis, and because of this constriction right here, there is the formation of a cyst. It actually looks like a cyst if you actually check up in a USG. So this is known as an encysted hydrocele of the cord. So basically you have the testis right here and your processus vaginalis is coming right down. It is just coming and stopping right here, and because of the constriction right here, there is accumulation of fluid just below the part of it, and now it starts to look like a cyst. Basically it's not a cyst, it's a hydrocele, but since it looks like a cyst, it is known as encysted hydrocele. Now then there is the vaginal hydrocele. Now this is one of the most simplest type of hydrocele and is the commonest one as well. The reason why it is known as vaginal is, no, it does not take place in female. Obviously hydrocele takes place in male, but the reason why it is actually called vaginal is the only place that you will find hydrocele and its exact anatomical place is just in front of the testes in the proper parts of tunica vaginalis. This is the most proper part of tunica vaginalis, and the accumulation of fluid takes place here, just right below, just right in front of the testes where the reproductive organ is. You have the accumulation of fluid, so this is known as the vaginal hydrocele, and it is the commonest type of vaginal. And this is the commonest type of hydrocele. In the sixth one right here, you can see that there is this entire bulging of tunica vaginalis. And the best part about this bulging is that it is two ways. You have the bulging right here, where it usually should be in the tunica vaginalis, but you also have a bulging in the peritoneal cavity as well. So you guys can see that there is two forms of bulging right here, the entire bulge that takes place, and because it has two type of bulges, it is actually known as bilocular hydrocele or hydrocele and bisac. And the reason why it is called hydrocele and bisac is obviously because there is formation of two sacs of which have fluid accumulation in it. And then finally you have the hydrocele of the hernial sac. So obviously you can see right here that we are actually correlating it with hernia. So this is the part where you actually have to understand is the processus vaginalis. I have told you in the before lecture, as I've told you in the starting of the lecture, is that processus vaginalis is basically formed by the peritoneum, and the contents of the peritoneum are the abdominal parts and contents. So as they leak with the fluid into the scrotal sac, and when the abdominal contents actually reach inside the scrotal sac, it becomes a hernia. So this is known as the hydrocele of the hernia sac. You have the abdominal contents as well, and then you have the accumulation of fluid as well. So this actually forms the hydrocele of the hernia sac. So with this actually concludes our here lecture on the hydrocele, its surgical anatomy, its types, and its pathophysiology of what actually happens. In the second part of the lecture, we will actually discuss the various types of treatments and the various things that a person can do in cases of hydrocele, the treatment options that a patient has, and its different type of clinical features. So stay tuned guys, and we'll see you guys in the next one. Thank you.